And you're welcome back. A bit of an update for you on the story we've been following all throughout the week, which has got to do with the renal dialysis unit at the Korle-Bu Teaching Hospital. The update we have and are getting through is that there seems to be a change in the situation now after days of mounting pressure on the authorities. The first meet is the head of our health desk joining us now. Yesterday we were just speaking with some of the patients who are in studio with us, sharing their thoughts on what should be done about this. But there is good news for them.
Yeah, indeed. After months of closure, the dialysis unit at Korle-Bu Teaching Hospital has been reopened to the public, and a statement from the hospital indicates that this happened yesterday. So since yesterday, we've heard from some of the patients who've also confirming
Right.
the hospital has started calling them to start lab tests ahead of dialysis treatment. But in this statement that the Korle-Bu Teaching Hospital has released, it is saying that they reopened following engagements with the health minister, Honorable Kweku Ajiman-Menu, and that engagement took 1 week to conclude. It says that the ministry is working closely with the health ministry, the hospital is working closely with the ministry to try and offset the 4 million debts that they've incurred as a result of under-recoveries.
And I was about asking that question simply because of the kind of reports that we've seen and the reports that, first of all, and that was disclosed to us by the CEO of the Korle-Bu Teaching Hospital, telling us that the hospital is indebted with over a tune of 4 million cedis. I believe that was the figure he gave. Yes. We don't know if that's out of the way now, is it?
No. So what the statement is saying is that the hospital is working together with the ministry to try and offset that $4 million CD debt that was occasioned as a result of the under-recoveries that they were making. You remember this whole story about the dialysis unit came up when we heard that the charges had been increased by the hospital, and especially without the approval of
and at this point, this is where there are so many questions, because what we see now on the screens are excerpts of that statement pointing out that the Korle-Bu Teaching Hospital is now informing stakeholders and the general public that the renal dialysis unit has been reopened, and the date they're actually giving is Monday. Which, of course, well, there are so many questions about that, because on Monday, the patients were equally raising concerns that the facility was not open as of then. But the 4 million debt now, as the statement is pointing out on the screens, is what is being dealt with now, working closely, as management is indicating, with the Ministry of Health, with the sector minister showing that something will be done about this. But there is also the point, Fred, that we're seeing about Parliament and the need for the House to expedite action on some proposed new fees and charges. That was the source of the whole controversy when, of course, a patient was complaining about the 700 cedis plus and charges as well. Is there any clear sense from the hospital on what will happen?
Well, there's not been much beyond this statement the hospital has released, but of course you can see that the under-recoveries or the charges they are taking from patients, which we said was too high or unapproved and therefore had to be reversed, it's actually hurting the hospital, and they think that to make this treatment sustainable, then they have to charge how much they have spent in treating the patients, so that they balance the books. Under this circumstance, the hospital is actually asking Parliament to approve the increases in the fees and charges to enable them to charge. You know, the conversation since we had the thought leadership on the dialysis crisis has been that, yes, people can't afford. Yeah, we recognize the need for us to increase the charges to meet our expenses on the service. But of course, people can't afford them, so either the NHIA will come in and support persons who need dialysis treatment, or the people will be made to pay, or government will find some way to do this.
From our sources, what's the hospital intending to do about the new fees and charges? Will it remain as the ministerial directive has been around the 300 or 400 cities, or this would still be the new charge of a 700 cities plus?
Well, the tone of the statement suggests that the hospital is looking up to Parliament to speed up the processes towards the review of the fees and charges. Until Parliament increases these fees, they will not be able to, it will be illegal for them to pass it on to patients. And that's why there was hue and cry when they did so. Therefore, they are asking Parliament as a matter of urgency to do this so that they can save the units. The unit can continue to run regardless of what costs they are incurring.
Fred Smith is the head of our health desk here at Joy News, and we'll keep following the story which we have done all throughout the week, starting on Monday, where of course we're bringing you some updates from our colleague Kwarting, who was there at the facility, pointing to us that the facility was not open as of then. And now the confirmation is that from management is that now the facility will now be open to our patients, which means that it's good news for the renal patients. And we will keep monitoring the space and bring you some updates. But for